A person with anorexia nervosa, often called anorexia, has the intense fear of gaining weight. Someone with anorexia thinks about food a lot, but limits the food that he or she eats, even though they are too thin. Anorexia is more than just a problem with food. It's a way of using food or starving oneself to feel in control of one's life, to ease tension, anger, and perhaps anxiety. Most people with anxiety are female. An anorexic has a low body weight for her or his height, resists keeping a normal body weight, has the intense fear of gaining weight, thinks that she or he is fat even when very thin, and misses 3 menstrual periods in a row for girls or women who have started their periods. It affects girls and women. It can also affect boys and men. It was once thought that women of color were shielding from eating disorders by their cultures, which tend to be more expecting of different body sizes. It is not for sure known whether other minorities such as African Americans, Latinas, Pacific Islanders, American Indians, and Alaskan Native people develop eating disorders because of American culture values of thin people. People with different cultural backgrounds may develop eating disorders because it's hard to adapt a new culture. The stress of trying to live in two different cultures, their own culture and the new American culture, sometimes causes minorities to develop specific eating disorders such as anorexia nervosa.
She wasn't born anorexic, but nowadays she suffers, staring at these half-naked stars on magazine covers, feeling pressured by the public. She only weighs 90 pounds, but still sucks in her stomach. On the inside she's dying, lying to herself thinking
5 more pounds won't jeopardize my health.
one day she might just collapse. She can't avoid it. Too many sleepless nights spent bent over a toilet, spewing vomit like she was an alcoholic, praying to a god she never believed in to stop it. Hasn't eaten in weeks, drinks water by the heaps. Now she looks like the skeleton she sees in a closet. So close to death she could taste it. Body looks wasted. Hates life, hates you, hates the way she looks naked. Now she's feeling drowsy, lousy, thinking maybe this world's better off without me.
I'm so sorry for all that I've done. I'm so sorry for what I've become. I'm so sorry for wasting your time. I can't hold it back 'cause I'm
I'm just gonna work on some papers. I might go out Saturday. Hey, what's wrong?
Look how sick. We have snacks in the kitchen, guys.
Are you okay? Come on.
Are we seeing? Pass it out.
Chips?
150 calories?
Hey, just eat them.
No problem.
Are you okay?
Not really. Take some of this. Sorry.
What's wrong with you?
What did you take breath for? She's so weird. She doesn't look funny. So, you gonna go to the movies after this?
Yeah, we should do that.
I can't. I gotta go to the gym and work out. Are you serious? You like work out every day.
Anorexia nervosa has huge effects on the body. especially the brain. This picture shows the activation of the extrastriate body area localizing from scans from healthy age-matched controls, which is the blue shown, women with anorexia nervosa, which is the green shown, and the reduction of gray matter in the extrastriate body area of the anorexia nervosa group, which is the white shown. Overlap between extrastriate body area activation of healthy age-matched controls and anorexia nervosa is colored in the light blue. This just simply shows the differences in the brains of anorexic and non-anorexic. Also, speaking of the brain, there is a major neurotransmitter that has been studied with respect to anorexia, which is serotonin. The diagram here portrays the two hypotheses related to abnormalities in the serotonin system that may contribute to anorexia. The first hypothesis is that people with anorexia nervosa have increased levels of serotonin in the brain, which may contribute to the common traits of harm avoidance and anxiety, as well as the general lack of effectiveness of SSRIs in treating anorexia nervosa. The second hypothesis has to do with the imbalance in serotonin receptors, which can be altered by both hormonal changes and stress. The evidence for this has to do with the usual onset of anorexia nervosa during puberty or adolescence, and many times the onset coincides with a particularly stressful time in the sufferer's life. Several things happen to your body with anorexia. With anorexia, your body does not get the energy from foods that it needs, so as a result, it slows down. Anorexia affects body parts such as your brain and nerves, hair, heart, blood, muscles, joints, and bones, kidneys, body fluids, intestines, hormones, and even your skin. In treating anorexia nervosa patients, it will help bring the person back to a normal weight, treat any psychological issues related to anorexia, and help the person get rid of any actions or thought that cause the eating disorder. Some research suggests that the use of medicines such as antidepressants, antipsychotics, and mood stabilizers may sometimes work for anorexic patients. It is thought that these medicines help the mood and anxiety symptoms that often coexist with anorexia. Other studies, however, suggest that antidepressants may not stop some patients with anorexia from relapsing. Also, no medicine has shown to work 100% of the time during the important first step of restoring a patient to healthy weight, so it is not clear if and how medications can help anorexic patients to get better, but research is luckily still happening. Psychotherapy in some of its forms can help make the psychological reasons for anorexia better. Psychotherapy is sometimes known as talk therapy. It uses different ways of communicating to change a patient's thoughts or behaviors. Some researchers also point out that prescribing medicines and using psychotherapy together for anorexic patients works better at treating anorexia than one of them alone. Whether or not a treatment works, though, depends on the person involved and his or her situation. Cognitive behavioral therapy is also a very effective treatment method. This teaches you about your illness, its symptoms, and how to predict when a symptom will most likely occur, and also teaches you to handle daily problems differently. Sometimes the way a person handles problems increases the likelihood of developing the illness again. This therapy also helps you to eat more regularly and help change incorrect beliefs about your symptoms, which reduce the power the symptoms have over you. Finally, this therapy teaches exercises that reduce fears and concerns about physical symptoms that develop during emotional stress. These exercises help a person bring physical symptoms such as irregular or fast breathing under control. Individual counseling and support groups are also very effective methods. In support groups, patients and families meet and share what they have been through. Family therapy, although, is the more preferable method of treatment. The leader of the study of a family-based therapy, Professor James Locke, professor of psychiatry and pediatrics at Stanford University, said, "This study strongly suggests that as a first-line treatment in general, family-based interventions are superior."